Good morning. I want to welcome you to the second, now annual, Summit on the Future of Rural Healthcare.
This summit is an opportunity to hear from the industry's most exciting voices sharing breakthroughs on how to build the workforce of tomorrow in rural America.
It is my privilege to be sitting right here next to the President of the American Medical Association to discuss physician burnout and how do we create a more resilient workforce.
We've got a workforce at risk. There are tremendous pressures. We've got an aging population, we've got an aging physician workforce, and we've got a rise in the care that we need to deliver.
We have a whole group at Microsoft that is literally focused on workforce crisis right now.
Small community or rural community hospitals are shutting down, and we already have a challenge with access to care, so we need to come together to solve this problem because we have to have people cared for.
I don't think there's any other group that is more sensitive to changes in health policy than rural residents.
The biggest challenge that we face as providers is meeting that workforce challenge. It will be the metric